a kid like Connor gets diagnosed. We find out there's a lysosomal storage disease unit at CHOP. We come and you're sort of our main point of contact. What is your role in these children's lives in that capacity?
It varies a little bit from storage disease to storage disease, but in general, the lysosomal program, especially the MPS clinic here at CHOP, our role is to really integrate and think through the holistic care of patients with lysosomal storage disease. We are actively involved in the diagnosis in many children's cases, but let's say you come in with a diagnosis like your family. What we do is we make sure that we're thinking about all the different body systems or organ systems that can be affected by these diseases from head to toe, and that you're following with all the appropriate subspecialists, that we're anticipating any medical issues that might arise down the road with these diseases. And we're doing everything we can to optimize outcomes. So physical therapy, occupational therapy, organizing all of that to ensure that we're helping our patients lead the best lives that they possibly can. Mm-hmm. On the other side of that, it's really important to us to stay up to date with all of the clinical trials going on. And so we can make sure that when opportunities arise and if families are interested in considering research, that they're aware of those opportunities and help facilitate that. Those are some of the roles we play here. But we see kids regularly. It depends a little bit on if our patients have an enzyme replacement therapy available. We see them more often because they're coming in to get infused. But we see children in clinic, every 4 to 6 months. And we make sure that they're getting all the care that they need, both in terms of everything head to toe, but also learning support.
Another reason, I guess, for the regular checkups and with all these different specialists would be to essentially baseline to see where they are now and where they progress each year.
And some children need interventions. It varies a little from MPS subtype to MPS subtype. But for example, even children with, let's say, MPS 2 that are on enzyme replacement therapy, we know that the enzyme replacement doesn't correct the bones. And so, unfortunately, many of our patients, as they get older into those teenage years, they have a lot of orthopedic complications, some of which require interventions like surgeries or bracing. And so helping families navigate at what point should I do X, Y, or Z, and making sure that they're getting the follow-up they need for that. Or you can have progressive cardiac disease and making sure they're being appropriately monitored and started on therapy when necessary for their cardiac disease. These are the types of features that we really think about. Because we don't focus on one body system or one organ, it's really our job to have no blinders and to think about everything head to toe.